This program is a This program is made This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch WisconsinEye on Spectrum Channels 995 and 363 and at wiseye.org.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. Joining us for today's media briefing are Governor Tony Evers and DHS Secretary-designee Andrea. Also available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer for the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everyone, and thanks for joining us again today. As many of you know, on Tuesday, I declared a new statewide public health emergency and face covering requirement, effective now until November 21st. Folks, we're facing a new and dangerous phase of the COVID-19 pandemic here in Wisconsin. As I said last week, at one point, Wisconsin was in a pretty good place, and just in August, we began to see a reduction in the number of new cases daily, a fact we attributed in large part to our mask and face covering requirements being successful. But with the start of the school year and campuses reopening in the last several weeks, Wisconsin is now experiencing unprecedented, near exponential growth of the number of COVID-19 cases in our state. A growth that's been primarily driven in large part by the unprecedented number of infections among 18 to 24-year-olds, who have a case rate of 5 times higher than any other group. And this has become especially concerning in our campus communities. Folks, our campuses don't exist in a bubble. By design, they are part of our communities, and they welcome students from all over the state and country. So it's critical that we work together now to get this virus under control, not only to protect our campus communities, but for the health and safety of Wisconsinites in every corner of our state. As I've said before, testing is a key to boxing in the virus. So in addition to the funding and support for testing and contact tracing on our UW campuses that we have previously announced, today we announced an additional $8 million for our private colleges and universities across the state to support their testing efforts. But Wisconsin, we need everyone to do their part, especially our young people, to stop the spread of this virus. I know we all want to get back to normal, but we will continue to see increases in cases until folks decide to take this seriously. It's on all of us to take precautions to keep our neighbors and communities healthy and safe. It's on all of us to help protect our healthcare workers and prevent our hospitals from being overwhelmed. And it's on all of us to ensure our small businesses can continue to operate safely and our economy has the opportunity to bounce back. Because public health is everybody's issue. And overcoming COVID-19 is on every community, every age group, and every Wisconsinite. It's on all of us together. Our statewide efforts have worked before, and they can work again. So please be extra cautious in the days and weeks ahead. While we continue to encourage folks to wear a mask, remember that it is not a substitute for physical distancing. Continue to maintain 6 feet of distance from those outside your immediate household, and skip heading out to the bars or to parties. Many businesses found new and innovative ways to serve Wisconsinites during the pandemic, so continue to use alternative shopping and dining options like curbside pickup and delivery. Catch up with friends and family members virtually, and remember that staying home continues to be the best way to prevent and getting and spreading this virus. And of course, wear a mask. Wearing a mask in public is a simple and necessary commitment to the common good that we should all be willing to make. Because that's what Wisconsinites do. We look out for our neighbors, we take care of one another, and we know that our state is strongest when we band together. So stay healthy and stay safe, Wisconsin. I'd now like to pass things over to Secretary-designee Andrea for her updates. Andrea?
Thank you, Governor. Good afternoon, everyone, and thanks again for joining us. We are entering a new and dangerous phase, as the governor said, of this pandemic here in Wisconsin. COVID-19, as you know, is a respiratory virus, and we know that most respiratory viruses reach peak activity in Wisconsin between late fall and early spring. If COVID-19 follows that pattern, we must be prepared and we must act now to stop the spread. For those of us in state government, acting now means we've declared a new public health emergency to address the new realities of COVID-19 here in Wisconsin. For each of us living in Wisconsin, acting now means making the choice to stay home. And when we do go out, wearing a mask. It means practicing good hand hygiene, physical distancing, and getting a test if you have symptoms or have been exposed to COVID-19. It means following the guidance of local public health departments, quarantining as you wait for your test results, and self-isolating if you test positive. And it means getting your flu shot to help prevent the spread of flu at the same time we are already dealing with COVID-19. The new realities of COVID-19 in Wisconsin are stark. There are now 108,324 confirmed cases of COVID-19 in Wisconsin. That is an increase of 2,392 cases over yesterday. Our 7-day average of new daily cases is 1,939, which is up from 665 1 month ago. Our total deaths have reached 1,265 Wisconsinites. All 72 counties in Wisconsin are seeing high disease burden. This is a statewide challenge, and we must meet it with both statewide and individual action. That is why extending the mask mandate was so important. Because yes, our case numbers are going up, and we also know that masks work. The science shows that they form a barrier against respiratory droplets that spread COVID-19. Mask wearing is only effective the more we do it together. Everyone can wear a mask safely, everyone who can wear a mask safely should wear a mask. We know there are some people who cannot safely wear masks, and that is why it's more important for the rest of us who can to do so. My mask protects you, and your mask protects me. So I'm going to say it just one more time. We all need to be wearing a mask whenever we go out. And equally important, please make the choice to stay home as much as possible. We were successful at flattening the curve in the spring because we all pitched in and stayed home. It is time to redouble our efforts and work together again to protect each other and our healthcare system. Thank you, Wisconsin, for your commitment to redouble our efforts, keep masking up, and making the choices that keep our communities safe.
Thank you. We'll now take your questions. A reminder to maintain audio quality, to keep your phones on mute until it's time for your question. And because we have a hard stop today, please only one question per reporter per outlet. And we'll begin this afternoon with Stephanie Hoff from WisPolitics.
Hi, and thanks for taking my call today. So I'm just wondering, you continue to say, masks are working, science shows it, but people in Wisconsin are not taking it seriously. So how are you going to get people to take this seriously? But besides, you plead with Wisconsinites to do this, but how do you get them to recognize that this is a risk?
Well, I'll just jump in there right from the get-go. I think it's important that everybody wear a mask. Obviously, we cannot afford to have 1,265 people die of that disease here in Wisconsin, and the numbers obviously exponentially higher at the national level. But we have to have our leaders set the stage. I see lots of fundraisers done, pictures of fundraisers done by our Republican colleagues where not a single person in the picture of maybe 40 or 50 wearing a mask. They're hugging each other. They're having a hell of a good time. No mask. Now, I'm not against their fundraising. We all do that. But at the end of the day, when our leaders in the state don't want to cooperate on this issue, it makes it difficult for people that support them across the state and others to say, well, I guess it's not important. So it starts at the top. We will continue to do what we can. Hopefully our Republican leaders will follow and will make a difference. But there's a $200 fine. I get it. That probably no police officer in the state of Wisconsin wants to involve themselves in a $200 fine. But we will continue to push this issue. I believe Wisconsinites can pull together, and they will.
Thank you, Stephanie. Now to Maddie Heim from the Appleton Post-Crescent. Maddie?
Hi, thanks for taking this call. Today we had heard from Admiral Giroir at HHS that there are plenty of test supplies for labs, but I know that you said earlier that we're not doing enough tests and the high test positivity rate indicates that maybe some people aren't being tested who you'd like to be tested. And he specifically suggested that some labs should look to use different types of tests besides the gene expert test, since that's the one that seems to be the most at issue right now. So I'm just wondering, has he communicated anything to you about this? And is the availability of supplies affecting how many tests are being done right now, in your opinion?
So I have not spoken to him directly, but I think it is important to recognize that diversity in testing supply, as he said, as you suggest he said, is critical. And it is one thing that we have worked really hard here in the state of Wisconsin to do, because as the supply chain continues to be fragile, as we continue to see challenges for our partners in getting different parts of of what you need to conduct these tests, as we've seen those pieces come in and out of shortage or be diverted or have other challenges, the diversity of our supply has helped us maintain our testing capacity, and so we continue to be committed to that. It is something we work on through a variety of methods. It is why our partnership with Promega and Exact Sciences is so critical to having a stable supply of tests on a weekly basis. But it is something we are focused on. It's something we continue to work on. But he is not wrong that diversity in your testing supply is a really important part of how you prevent shortages. I think more broadly, what you've given us an opportunity to talk about is the fact that if you need a test, you should get a test. We have capacity in our system. If you're experiencing any kind of symptoms, please get a test, call your local healthcare provider, go to one of our community testing sites. But we do have tests available every day, and we would encourage folks to get tested if you need a test. It is the first step in us identifying where the virus is so that we can do the work that needs to follow to stop the spread.
Thank you, Maddie. Now to Kent Wainscott from WISN TV in Milwaukee. Kent?
He's a minute behind here. Hi, Governor. You've talked about getting people to buy in and to comply with the mask mandate, but extending the statewide mask mandate is really more of the same. You're taking the same action you've taken for months, and yet we've seen these cases soaring. So what additional steps are you planning to take? What are you going to do differently to address this sudden spike in cases?
Well, here's the deal. Last April, the Supreme Court, with being allies with Republicans, closed down our safer at home order, and that is essentially precluded all sorts of mitigation strategies. Whether it's numbers of people in bars and restaurants, or whatever. We had a plan for a safer opening for the state of Wisconsin. That didn't happen. Those things are, frankly, out of my control. And as you've seen, in the recent time, they even took Dane County to court to stop them from some mitigation efforts. So I'd be glad Republicans can come into Madison at any point in time and pass some things, and I'll get behind them 100%. That would mitigate and make a difference in this. The masking is what is important, as is contact tracing, as is testing. Those three things are the most important things that we can do, and we will continue to do that until we drive this number down. But just remember where we were last April, and look at where we are now. And I can tell you that I believe it would look a lot different if the chaotic decision of the Supreme Court did not happen.
Thank you, Kent. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. This might be a question for Palmer Westergaard. I was just kind of curious, you talk about flu season coming on the way. Obviously, we've seen statewide, the Wisconsin Hospital Association is reporting a new kind of peak in hospitalizations. I was just curious if there's, with flu season on the way, if there's any additional concern or heightened concern with those hospitalization numbers.
Yeah, absolutely. And Dr. Westergaard will probably want to say a few things as well. I think it is exactly, Mitchell, one of the things that makes this a critical moment in our response, and why we need together to make choices that will help reduce the spread of this disease. Because as we see flu season come into play, our frontline healthcare workers and our hospital systems are going to have to not only treat what they see on a regular basis, plus COVID. They now are faced with a flu season, which does always result in hospitalizations and death. That is just something that we know happens every year. And so while we are working very hard and trying to drive a message of increasing flu vaccination, everybody in the state of Wisconsin, it's more important this year than any year to get a flu shot. They are available at your pharmacy, call your primary care, but get a flu shot, because we will mitigate the need for hospitalization and taxing our healthcare system, the fewer people who get flu this season. And so it is an important thing. It is an important action we can each take to help, again, protect our hospital system, our healthcare workers. But you're right, the numbers we have seen in recent days in hospitalizations are concerning, and it again emphasizes why it's important to act now. It's important for all of us to make choices now, because, right, what do we know about the incubation period, right? We need to do things that have impacts a couple weeks from now, considering the length of time it takes for COVID symptoms to develop, for us to understand who and where the disease is escalating. And so we need to take actions now in light of some of these initial signs we are seeing in hospitals, what we know about flu season. So it really does emphasize the importance of our actions right now to stop the spread and protect each other and the state more broadly. But I don't know, Dr. Wester, if you want to say more.
Well, I'd emphasize the fortunate thing is that we have strategies to minimize the impact of influenza that we don't have for COVID-19. We have effective vaccines. We have antiviral drugs. And thirdly, we know that the evidence is accumulating that the same infection prevention strategies of hand washing and face masks and social distancing seem to work very well for preventing the flu. So it's in all of our interest to minimize how much influenza affects us. And we have things that we can do. And in a large part, they line up with the things that we need to do also to prevent the spread of COVID-19. Because it's tremendously concerning to think about the possibility of a bad flu season on top of a COVID-19 pandemic. So we need to use all the tools we have to make it as low of a risk as we can.
Thank you, Mitchell. Now to Mason Dowling from WAOW-TV in Wausau. Mason?
Hi, can you hear me? Perfect. Thank you. Thank you for taking this call, Governor. I wanted, and DHS, I wanted to ask basically whoever feels like fielding the question. Here in central Wisconsin, we've been seeing several counties reporting record daily numbers, Marathon County, Portage County, Clark County as well, that are seeing record numbers of new cases, and now the county health department are saying that their contact tracers are becoming overwhelmed trying to respond to all the people that may have been in contact. They are currently at the county level pushing for not to get a test unless you have symptoms, which is obviously a bit different than what Andrea was saying. So I just didn't know if you had any reaction to the growing amount of cases here in central Wisconsin.
Yeah, it's a great question, Mason, and it does, again, speak to the need for all of us to act now to make choices that help reduce the spread of the disease, because while we talk about the lagging indicator and the worst case scenario of our healthcare systems and our frontline healthcare workers becoming overwhelmed, we certainly see earlier than that the jeopardy that our frontline public health system is in, and as they can become overwhelmed as cases surge in local communities. And I think what you're talking about in central Wisconsin, and certainly what we're seeing more broadly, because this disease is widespread in Wisconsin, is that the surge capacity we have built as it relates to contact tracing needs to be expanded. And we at DHS have brought on an additional 24 contact tracers that started today. We have an additional 60 starting next week, and we'll have additional folks coming on board in the weeks after that. But we at the state are working to be able to provide wraparound surge capacity for local contact tracing efforts. But it really is important that folks answer the call when it comes from a contact tracer, provide good, truthful information so that they can turn and do the work related to that. But more fundamentally, that we do what we need to do to stop the spread so that there are less contacts, less tracing work that needs to be done by contact tracers so that they do not become overwhelmed. But we certainly are hearing increasingly from our local partners that contact tracing is becoming more difficult as cases are escalating around the state.
Thank you, Mason. Now to Scott Bauer from the Associated Press. Scott?
Hi, thank you very much for this call. Governor, in the past, you've supported UW students returning to campus. About a month from now, there's going to be a home football game. While fans won't be allowed in Camp Randall, it seems likely that students will be congregating all over campus for that game. What steps, if any, is the state recommending the university take to prevent that, and how concerned are you about that home football game, despite there being a crowd, being a super spreader event?
Yeah, and that is, Scott, that is a huge issue for us, and we're going to actually be asking the Big Ten to help out with that. The Big Ten is spending a lot of money to bring football back into play, and they're spending a lot of money for the testing and other things of football players. They need to step up and have a significant stake in this game. Outside of, football is about football players and football fans. And I expect the Big Ten should be doing a PR campaign around this big time. They are part of the people that made that decision to bring back football. I'm not arguing with the position, but I believe that they also have an obligation around that. We're also working with UW-Madison on this issue, and Dane County, obviously, they have a mass gathering order, and we're hopeful that the city of Madison will help us also as it relates to making sure that people understand the importance of keeping those crowds small. But it is a huge issue. I was also concerned about the Packer game the last weekend, and it seemingly went pretty well without major problems of people, large groups of people all over the place. So we can watch those games at home. I plan to, and let's get everybody involved in solving the problem before it becomes one.
Thank you, Scott. Now to Emily Matisik from WBAY TV in Green Bay. Emily?
Hello. I'm just wondering, sort of seeing large lines, Winnebago County, especially in northeast Wisconsin, had to shut down their testing site early, their community testing site early yesterday. Just wondering what's being done to get more testing availability, especially here in northeast Wisconsin. As I mentioned, Oshkosh and Winnebago County and in Brown County. Will you consider reopening these large community testing sites again and sending in the National Guard to run them?
Yeah, thank you for the question. We are currently working with regions around the state that have not had as ready access to regular community testing sites and will be moving into those regions on a more regular basis using the assets that we have as it relates to specimen collection and test kits because we do, to your point, we do think it's very important that access to testing is readily available in communities across the state, and so we absolutely are working to move into those areas where we are seeing that where we could be helpful, where we could bring assets to the table to improve access to testing for all of Wisconsin.
Thank you, Emily. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding this. I saw the DHS health alert this morning saying that positive antigen tests are being counted in daily totals, but not negative ones. Could that be part of the reason why we're seeing a high positivity rate? And how widespread is antigen testing in Wisconsin? Thank you.
Yeah.
To address that. So this is a situation that's changing pretty quickly. Antigen tests have been procured in large numbers by the federal government or being delivered to nursing homes, and they're just sort of figuring out and sorting out the best strategy to implement them. So antigen tests have been available on the market for some time, but they haven't been in widespread use. So traditionally, up till this point, they've comprised a relatively small proportion of the testing that gets done. Now, it's likely to think that it's going to increase, and we need to be prepared to communicate that and understand that. I haven't seen data to indicate that they've supplanted a large amount of the molecular testing or the diagnostic testing that we're doing. So I don't think that's an explanation for why testing numbers are lower than they could be or should be. But it's a resource that we're learning more about. We're trying to collect and generate and understand the data about what the limitations are and figure out how to use them in the way that is the most strategic and the best use. Because the advantages of antigen tests is they can provide a result relatively quickly. The disadvantages is they're not as accurate. So when they're used for screening people without symptoms, they can result in falsely positive tests, sometimes more likely to have falsely positive tests than truly positive tests, depending on how widespread the infection is in a population. So the Health Alert Network message this morning was really trying to describe this rather complex situation and communicate to all our partners about how we need to focus on the strengths and limitations of these. But I think going forward, we'll see more of them being used for diagnostic purposes, and we are taking positive results on antigen tests very seriously, and they result in follow-up in the same ways that positive molecular tests do.
Thank you, Sean. Now to Sierra Trojan from Fox 11 in Green Bay. Sierra?
Good afternoon, and thank you for taking my question. Governor Evers, how will the $8 million for testing be distributed to universities? And what have your conversations with Tommy Thompson been like to try to reduce the spread at universities?
I believe, and we can get back to you on this, I believe the $8 million was distributed per student. I can't imagine any other way that it could have been. So obviously I don't have the answer, but if I was a realist here, I can't imagine any other way than the number of students, percentage of students that the universities have.
Thank you, Sarah. Now to Adriana Mendez from TMJ4 in Milwaukee. Adriana?
Hi, Hi. Good afternoon. When a COVID-19 vaccine does become available, the state of New York said they would create an independent task force to review the safety of that vaccine. Is that something Wisconsin will also do?
I didn't hear the first part of your question. I'm sorry. Can you repeat that?
Yes.
Vaccine for the virus.
Oh, for the vaccine.
Yes.
So I think, vaccine is actively in phase 3 clinical trials for consideration. Once they get their data packages together to submit to FDA for approval, we are actively planning what we will need to do as it relates to vaccine supply, vaccine distribution, and the role we will play in helping to make sure that Wisconsinites have access to a safe and effective vaccine. As it relates to an independent commission, that is not something we have discussed in any level of detail. But obviously, if it's something that we move to consider or decide to launch, you'll be the first to know.
Thank you, Adriana. Now to Will Cushman from WisContext. Will?
Good afternoon. My question is for Secretary-designee Tom. I'm wondering if you are able to confirm that there may be an update to the electronic disease surveillance system rolled out sometime in early October, and if so, what the purpose of that update is.
Yeah, so we have started working closely with our local public health partners about a needed upgrade for the system that would specifically enhance the contact tracing functionality, as well as some of the issues around importing test results that would further make that more efficient. So we're in the early stages of planning that. I think we will be more able to make an announcement about the details of that in the near future. But it is an upgrade that will ease and will help with our efforts here in the response.
Thank you, Will. Now to Sean Ryan from the Milwaukee Business Journal. Sean? Again, Sean Ryan from the Milwaukee Business Journal. Okay, we have to move on then to Danny Maxwell from WKOW-TV in Madison. Danny?
Hi, thank you for taking my question. We talked about the WHA and it kind of it's reporting the new peak in hospitalizations. Things have been pretty stable here locally in Dane County and Madison where we are. But I'm just wondering if you can tell us which areas of Wisconsin are seeing those high hospitalization rates? Where are they? And could some of those patients be moved to other hospitals like in Madison if those hospitals become overwhelmed at some point?
Yeah, that's a great question, and it does speak to the really important planning and work that the hospitals did together and with within their regions and across the state, thinking about these kind of questions and in anticipation of needing to essentially be backup to each other, right? That's what surge planning and surge capacity is about in its most extreme form, right? The hospitals within their own system do surge planning so that they can flex and transition beds to different levels of care to manage their patient load within system, and then you share across systems, and then you think about sharing across regions. And it is also why our alternate care facility is a really important insurance policy that we have invested in with CARES Act dollars to make sure that if that sharing, that working together on surge capacity and surge planning does not provide the kind of capacity that a hospital might need, that we have the backstop of the alternate care facility to provide that space and that availability so that people who require hospitalization can have access to it in a way that most meets the needs of what they of the illness they are needing hospitalization for.
Thank you, Danny. Now to Eric Gunn from Wisconsin Examiner. Eric? Eric Gunn? And a reminder, *6 to unmute your phones. Okay, we'll try to get back to Eric if we have time. We'll move on then to Casey Nelson from WTAQ in Green Bay. Casey?
Hi, thanks again for holding this call. A lot of schools across the state, and especially up here in Northeast Wisconsin, either start the whole year virtually or they're going back to a virtual model due to rising numbers in their communities and things like that. Is there any kind of guidance from the state or DHS just for how schools can handle these kind of things and how even parents can handle these situations to keep these numbers down and get kids back in the classroom at some point this year?
Yeah, we did, Casey, provide guidance around outbreaks and thinking about if you identify cases in your school, what does that mean? What tools do you have? How do you notify parents? The kinds of mitigation, everything from cleaning to other strategies that schools can employ so that you are able to either maintain in-person learning because you are able to, it's one classroom, it's not wider spread. So how do you target that, for example? Or if you are virtual or go virtual because of an outbreak, the kinds of strategies and actions you can take to return to in-person learning if that's what local leadership at the school is striving to do. But that guidance is out, it is available. And obviously, we always are happy to continue to work with local public health and with schools as they face particular situations and have questions or need further, technical assistance from us. We are always ready and available to do that kind of work as well.
Thank you, Casey. Now to Jeremy Nichols from NBC 15 in Madison. Jeremy? Jeremy Nichols from NBC 15.
Excuse me, this is Eric Gunn. My call dropped right when I was getting ready to ask my question. Is there time for me now?
Please go ahead.
Thank you. Several months ago, the state DHS was looking to hire 1,000 contact tracers. It's never been exactly clear what happened. We did not seem to achieve that goal, and I'm wondering if you can lay out the specifics of why that didn't happen the way you had hoped it would, and what you may have learned to do differently from that.
Thanks, Eric. So our goal was to hire 1,000 contact tracers in the state of Wisconsin to do this work. We with our local public health partners, have about 1,240 contact tracers statewide. In conversations with local public health and in developing building up the infrastructure for contact tracing through the spring and into the summer, we provided funding to local public health departments for that hiring, to get us to that 1,000 so that we in combination reached that goal. We continue together to need to surge those resources beyond the 1,200 and change, 1,240, I think, that we have now. So today, I think I mentioned, we have an additional 24 assets from DHS that are going to surge into the system. We are hiring additional tranches now. 60 of them will start next week, and we'll roll into following weeks with additional contact tracing assets. Local communities continue also to staff up. The University of Wisconsin continues to bulk up its contact tracing staffing assets, recognizing the surge and the need for all of us to have additional assets to do this work. But again, I think to the previous question about contact tracing, we are certainly at risk of overwhelming the public health system as it relates to our contact tracing, and it speaks only to the need for us to do everything we can together to make choices individually to help stop the spread. So mask wearing, staying home as much as possible, the things that we know are effective, we need to be thoughtful and make the choice to do those things more vigilantly and in more instances here in the coming days and weeks to really get this under control and stop the spread.
Thank you, Eric. Now to Steve Westergaard from the Platteville Journal. Steve?
Thanks for taking my question, which is the news release that announced the extension of the mask order specifically mentioned universities in the 18-24 age group. So what I'm wondering is the state considering anything that is specifically tied to UW system campuses to stop the spread, such as forcing the campuses to close to in-person instruction and going to virtual instruction sooner than they are originally planning, or starting later next semester or whatever. Anything like that in the works?
Well, we are my staff and former Governor Thompson's staff at the University of Wisconsin system and the individual campuses communicate regularly on these types of decisions. So we believe that we have a good working relationship, and that we will continue to have that good working relationship and utilize the plans that we are collectively putting together to make sure that everybody's safe. So as far as specific interventions, that's something that we'll work with the system on and the individual campuses. But most importantly, at this point in time, it's making sure we get enough testing on those campuses, making sure that we have the contact tracing so that people can isolate and not be spreading the disease to others. It is something that I believe with the proper effort on everybody's part, we will be able to together solve this on the campuses.
Thank you, Steve. And we have time for one more question today because of our hard out, and that belongs to Jeremy Janine from Urban Milwaukee. Jeremy.
Apologies because I got to the call a bit late. For Secretary-designee Palmer, maybe Dr. Westergaard, we are seeing a surge in active hospitalizations, but the number of people newly hospitalized each day seems to be holding steady. That would seem to indicate that the average hospitalization is getting longer. Is there any sense to why that is?
No, I don't believe we have data to describe the factors related to length of stay. I think the clinical management of people with COVID-19 has evolved. I think a lot of critical care specialists feel like they have a better equipped toolkit of treatments. There's evidence that using anti-inflammatory medicines such as corticosteroids reduces deaths significantly, and we have one antiviral drug that has evidence. So as time has gone on, I think we've learned lessons that allow us to manage patients more successfully and prevent deaths in the hospitals. But in terms of the specific trends that we've seen in Wisconsin, I'm not sure we can attribute it to any one thing.
And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.